Hello, my name is Warren Schofield. I'm a partner at Troytown Equine Hospital and I'd like to give you a tour of the hospital today. So please follow me. Troytown Hospital was founded over 30 years ago and we have a range of facilities for investigating and treating your horses. We've got a top-class surgical facility and facilities for bone scanning, MRI scanning, which are used in the investigation of lameness problems in horses, and lots of other things that I'd like to show you. This is the main hospital barn, and in here we house all of the very sick horses in the intensive care unit. These are our intensive care boxes where we can maintain a horse on intravenous fluids and give them as much intensive care as needed. Across the way here we've got a horse who's recovering from surgery this morning. This is our radiography suite where we have fully equipped digital radiography to look at all aspects of the horse. In here we have the screen. This horse has got a back problem and we've got some x-rays of the horse's back which show the lesion quite nicely. We have full digital radiography, but we can also print off the x-rays onto screens as well where required. This is the shock wave therapy machine. And shock waves are waves of high pressure that go into the tissue from the handpiece. They act to heal tendons and ligaments and bony tissue. And many injuries in horses are actually quite close to the skin. So this treatment works very well on injuries like tendon injuries, ligament injuries, and for example splint bone injuries or sore shins. And this is the handpiece, and I'm going to just put it on myself. It makes quite a loud noise, and we can put it onto our skin and it's quite an intensive pressure wave. Shockwave therapy, we think, works by stimulating growth factor production in the tissues, which actually orchestrate healing rather than allowing inflammation to proceed. So what we see with the shockwave therapy machine is a pain-killing effect. And this pain-killing effect can be last for a good few days, but sometimes even longer periods, and that is extremely useful. Also, by stimulating the growth factors, we're stimulating healing. There are lots of research, lots of experiments being done on treating wounds in horses with shockwave therapy, as there is in humans as well. So in humans, wounds are being treated with shockwave therapy, and also injuries like tendon injuries like tennis elbow, repetitive strain injuries, which a lot of the injuries in horses come into that category too. Bone scanning involves injection of a radiopharmaceutical tracer into the horse, and this tracer shows up the areas of inflamed bone or joints, and this horse here is being bone scanned and having a back scan to investigate a back problem. And the camera goes right up against the horse. The horse has to be sedated fairly heavily in order to prevent it from moving around too much, and this will allow us to scan a horse's back and investigate the deep-seated problems which may not be present on an X-ray examination. This is the MRI scanning room, and we use this to investigate lame horses, and we scan horses' legs. The problem with lameness in horses is that sometimes it's not obvious exactly where the problem is, or whether the problem involves the bone or the soft tissues, the tendons and the ligaments. And this is where the MRI scan is extremely useful. If horses could talk, then they could point out where their soreness, where their lameness actually originates. But what we have to do in lameness diagnostics is actually work out where the horse is lame, and we do that sometimes by a series of nerve blocks. We desensitize an area of the horse's limb for a period of about an hour, and if the lameness, if the stride improves when the nerve block's in place, then we know that that little area that we've desensitized is the source of the lameness. One of the major problems we have in show jumping horses and sports horses is navicular syndrome, and this is where there's pain in the front feet, and The only way to work out that the pain is exactly coming from that area is to do some nerve blocks. And once we've done the nerve blocks, we take some x-rays. But there's a great problem with x-rays in that they actually don't show the soft tissues very well at all. And so therefore we can't identify tendon injuries and ligamentous injuries in the foot. There's also many conditions of the bone, for example bone cysts and navicular disease, which actually don't show up very well on x-ray examination. So these limitations, we've become much more aware of those in the last 10 or 20 years really, and that's where scans like the MRI scan are proving extremely valuable. Because in order to give an accurate treatment, an accurate prognosis, we need to get as refined a diagnosis as we possibly can manage. This is our video endoscopic suite. Okay.
That's the movement.
Oh, that's
yeah,
right.
Like you're doing plenty of movement and that's some scan wheels.
Oh yeah, no, he's a hunter. I mean, that is well, you know, this was a grade 5 year as well, so I think you sculpted him in the region. So I'm fairly happy with that.
We'll come back out and just do
This horse has a wind problem and he's going to undergo a laser surgery procedure. This is our padded induction room where the horses are subject to general anaesthesia, and it's padded all around so that it's very safe when we induce them and they go from standing to lying down. This horse is anaesthetised and is in the surgery suite and is undergoing a surgical procedure. He was anaesthetised in the padded induction room, and once his surgery is finished he will be transferred to the padded recovery room where he will stand back up on his feet again. We use tail ropes and head ropes to steady them as they are recovering from general anaesthesia to make that phase as safe as possible.
This horse has just recovered from general anaesthesia, so he recovered quite well. We're just about to return him to his box, but he's still quite sedated, so we'll have to be very careful.
Thank you for joining us on this tour of Troytown Hospital. I hope you found it informative. If you would like to discuss any of your healthcare problems with the vets at Troytown, then please feel free to contact us. Use the contact form or just give us a call on the number on the website.